Hello everyone, thank you for joining today's Zedmed Lunch and Learn webinar. Today's topic will be going further with clinical. I'll just give a couple of minutes for any attendees still joining our session. Back in a moment. Okay, let's get started. So the topics we'll be covering today will be the doctor's waiting room, the results inbox, continuing on with an overview of clinical with regards to a patient encounter. We'll also look at the RFE and Auto Text macros, as well as an overview of My Health Record in the Zedmed system. Some housekeeping items to talk about. Please remember to mute your microphones just with the little mute button to the left-hand side of your control panel. You'll also notice there's an orange button above your microphone with an arrow. This will allow you to hide and show your control panel so that it's not hiding any of our presentation today. You'll also notice a chat section in your control panel. Please feel free to type any questions as they arise during our session today. I'll endeavour to answer those at the end of our session. Okay, so our Zedmed Clinical system. Let's begin with the doctor's waiting room. So as we can see, I have Dr. Kramer's waiting room. I am logged in as Dr. Kramer, and what we can see is we have two patients that are currently appearing. I can see that Eric here has his appointment time at 9:30 and he's been attended at 9:13 by reception. Now, Eric is actually booked specifically in with Dr. Kramer. I can see Dr. Kramer's doctor code there. And you've probably picked up that our patient Paul doesn't have an appointment time, has been attended by reception, however, hasn't been assigned a doctor. So when we see 3 question marks, this is reflecting a walk-in patient. Now, because we're logged in as Dr. Kramer, if Dr. Kramer has an opportunity or has a time slot that's free, he too can pick up walk-in patients by admitting them, which we'll have a look at in a moment. With the waiting room, There's a few functions we can perform here. Generally speaking, the waiting room is a great way for a doctor to begin his encounter with his patients. Let's see what that looks like. I'm going to select my patient here. Now, there's a few ways I can admit my patient. You've probably noticed that there's an admit button down the bottom of our window. That's probably a common way of doing it, or the easiest way of doing it. There are different ways of admitting, for example, with a right click. Now, different people use computers differently. Some people like to click on buttons. Some people like to do a right click. So we've got a few different options there for you. So what I'm going to do, I'm a right clicker. I'm going to select admit. Let's have a look at what that does. Just going to close my patient warning there. So as we can see, I have my encounter window that's appeared here. What's also happened is my encounter timer has automatically begun. Now, the reason that's happened is because I've chosen to admit through the waiting room. And if we just jump back into the waiting room, you'll now notice that Eric has an admit timestamp under the admit column. Now, this is great for your reception staff or your managerial staff, keeping an eye on the clinic's waiting room, particularly currently with a lot of health concerns going around. In the essence of safety and communication, I'm sure receptionists are going to be extra diligent about monitoring where their patients are in the clinic at all times. So the benefits of using the waiting room, as you can see, I've created that 9:34 timestamp. Now, in theory, your reception staff or your practice managers who are keeping an eye on the waiting room, they can actually see that timestamp and mentally sign off on that patient being in your consulting room. If doctors choose not to use the waiting room, yet the rest of the clinic is, it's going to create a bit of confusion. Because if the patient's not in the clinic's waiting room physically, they're going to ask questions. Where's that patient? Have they gone to the bathroom? Have they accidentally walked into the pathology lab? So the waiting room is a great way for everyone to be aware of where patients are at all times. And as you can see, the benefit for the doctor is it automatically starts the patient encounter and brings up the patient, beg your pardon, the encounter window, ready for the doctor to begin his progress notes and start kind of communicating with his patient as to why they're attending. Great. So I'm going to use Paul this time. I'm going to do a right click on his name and let's look at the difference now. I'm going to choose clinical details here. Now, as you can see, we don't have an encounter window sitting above our history. I don't have an encounter timer. And my encounter control panel here, the start button is active. So if I wanted to start an encounter, I could, but remember, I'm not creating that timestamp in the waiting room. So just to summarize, the right click is a great way of admitting, as well as just viewing clinical details. If a doctor just wants to look at the patient's history, clinical details is a good one for that. Before we move on from the waiting room, I will highlight that there are a couple of, there is a way to order the patients that are listed here. Generally, the attendance time is probably what you would leave it as. And we also have a not billed as well as all. So if a doctor wants to make sure that their patients have been billed, they can do that from their own waiting room without having to jump outside of the clinical side of Zedmed. You'll notice that there's a show hidden attendances checkbox here. Now that's in the event that reception staff have hidden attendances for whatever reason, the doctors can also view that there. This waiting room will automatically refresh every 10 seconds, so the doctors don't need to worry about it not auto refreshing. There is a refresh button if your clinic has set a longer period for the refresh. Excellent. So that's our doctor's waiting room. Just going to close out of that, close my patient. I'm going to leave Eric's encounter ticking away there. And I'd like to move on to the results inbox. All right. So here we have our results inbox, and any results in the inbox basically mean action items. Action items for your doctors, action items potentially for reception staff, in the event that the patient hasn't been correctly linked to the result. So this is something that should be checked probably daily, probably one of your morning tasks to perform at the start of the day, and then repeat that throughout the day just to have a look and see if any results have come through. I mentioned the results inbox linking patients. Now, currently we can see on screen that we have a result for our patient Eric. However, the one underneath it, there's no patient name listed, so it hasn't quite, Zedmed hasn't been able to match up who this result belongs to. Now, how does Zedmed know how to do that? With the results inbox, it's going to look for 3 points of ID. Those 3 points of ID would be the patient's name, the patient's date of birth, as well as their Medicare card number. If it can identify all of 3 of those points of ID, it will automatically link your patient, as you can see here with our X-ray. If I wanted to unlink a patient or link a patient for that matter, you can see here I've got an unlink result option, and all I need to do is right click on the result to bring up the menu here. Let's have a look at linking a patient to results. I'm going to do my right click again, and it's going to try and do a search or a link for me. So I'm going to say link to possible patient matches, and it hasn't really found anything. If it did, I would see some patient options here. I'd see a list of patient names. So I'm going to click on the Find Another Patient button. And I know that this result also belongs to our patient Eric. Great. You can see now I've linked that second result with our patient Eric. And that's basically how we can link and unlink results. There may be times where Zedmed thinks that a result belongs to a patient. It may have gotten it slightly wrong. You will need to also perform the unlink function. What I've demonstrated today is just the linking function. So just be mindful with linking and unlinking. Great. Let's move our attention now to the bottom of the screen for a few moments. So we have some action buttons down the bottom. Now, we like to refer to these as speed buttons because they perform nice, quick actions in a speedy manner. However, what are those actions? What is it going to perform? And the best way to find out is if I hover my mouse over each of the buttons, it gives me a little description of the actions that it's going to perform. These buttons can be customized. They're not locked into the system. So each clinic can have their own variation of the action items, depending on the strategies that they have implemented at the clinic. Some clinics, the doctors contact the patients. Some clinics, the doctors will reassign that to the nursing staff or a senior receptionist to contact the patients to book them in, for example. So depending on your strategies, you will have, you do have the ability to customize these buttons to meet your needs. What I will go through and I'll deep dive into is the update result button. So the update result button is giving you full control over what actions are going to be performed. So we have these other speed buttons that I've just discussed. I'll demonstrate the update result button. It's basically going through step by step what some of these buttons would perform for us. So let's just have a look at this window that's popped up here. So I'm going to start with the common phrases window here. You can see that there's common phrases that have been entered into the system. And this is just to save time on you having to free text out a message over here. So as an example, I can say, double click on nurse, make appointment urgent. And if I wanted to assign that to the nurse, I can click the radio button here, make that active, click on the menu, pick out my nurse and click send. What would happen is that would then be sent to the nurse's results inbox, and they would see that Dr. Kramer has indeed sent this over to them with this message to make an appointment, which is urgent. With that, you could set a priority to urgent as well. I'll probably do that in this instance. Also down the bottom of the screen, you'll notice an audit trail. So the audit trail will show you all actions performed by staff members with this particular result. As I was saying earlier, depending on your strategies at your clinic, I might just click cancel and go back in here to show you this. There we go. So if we are contacting the patients directly from the results inbox, whether it's the nurse or it's the doctor, you can also enter a message in here. Let me just pick out one here. Let's say the top one there. All okay, no appointment needed. And you might add there, Dr. Kramer. Once I tick this little checkbox here, send this message to the patient, and this is assuming Mr. Banner has his mobile number entered, which I can see there he does. I could then click save, and that would go off to the patient to say that your results have come back, everything's okay, and no need to rebook in. Great, so that's the update result window there and all the functions that we can perform. I will also discuss the status of results, the different statuses that we have. So currently, I have two results relating to Eric, and they both have a red status with an I symbol. That I is indicating that it's the first initial stage that a result comes through in the system. So it's the first alert that you'll see there, red, kind of wanting your attention. And this is indicating that no action has occurred as yet, and there's following action to occur. So as we've just discussed with the update result button, if we actually go ahead and update one of these results, let's assume our nurse is sent it back to us. you can notice that it's gone into the next status, which is the yellow pending status. What that's saying is some action has occurred, yet there's still more to occur. It's making its way onto the complete status. So it's kind of sitting in the middle. If we were to go in and click on Update Result, we can see the audit trail there as well. So all actions that have performed with this result. Let's have a look at viewing these results through the patient record. Just going to close out of here, over into my summary views, into the results tab, and here are my results. So you can see that looks like our patient has kind of a consistency with their current issues at the moment. Looks like looking into some blood tests, and maybe our patient, Eric, is having trouble with his knees, unfortunately. So you can see that in the past that he's had a couple of results come through, and looks like the doctors reviewed them and potentially had a consult with them and marked them as complete. Now let's assume beg your pardon, Eric is sitting in the doctor's room and we're having a discussion. Here's my result. Now to actually bring this up on screen to show Eric, I can do a right click and go down to view results. And here's my X-ray of the knee. Something to be aware of is the controls up the top here. I noticed that my right arrow is active, and that's saying that there's another page. So there's actually two images here. So be mindful of that in the event that there's been two images or two files linked to the one result. I'd hate for anyone to miss out on a second image that's come through or a second result that might have some key information in there. So just be mindful that if you're wondering on our previous screen here why there's not two X-ray results, potentially because they've been linked into the one result, and there's multiple pages there, as you can see. Yeah, great. So what I can do now is, if I've reviewed this with Eric and there's no further action to occur, I can do a right click and change the status to complete. We also have the some blood test results that have come through. I can right click, view results. Again, here's my results. You notice that there's no other pages on this particular result. And I could have my discussion here, and you'll notice that there's some different speed buttons down the bottom this time. I'm going to go ahead and click on Mark Result as Complete. While we're looking down the bottom there, another great way to jump between results. So that's a quick summary and overview of the results inbox. Let's move on to our patient encounter. So carrying on from our previous session, what we'll jump into is the observations module. So the observations module is where we can enter in our observations and measurements. There's a few things we can do here. So if I have previous values recorded in the system, I can simply double click in these fields to bring them across. If there is no prior measurement or value, as you can see, I've tried to double click on pulse, but there's no result in the system, so I can't bring back anything. So that's one way to pull in data here. Another way is, obviously, we can simply free text information into there. You'll notice that we have this icon repeated through our form here. This is the graph icon, which plots your data in a visual manner. So being the visual beings that humans are, I would recommend using the historical graphs here to potentially show your patients, particularly if we're setting health goals and things like that with lowering blood pressure over a time period. With that goal in mind, this would be a great way to celebrate successes with your patients and view a nice downward trend with their blood pressure. Another good one would be, if they have weight problems and they're setting weight goals, we've also got a graph icon here. With your searches. So first of all, we can do a right click to add to favorites. But if I'm looking for a test that, say, begins with the letter K, I'm pressing K on my keyboard and nothing's happening. So you can do a search. I chose a bad letter there, K, but I've just pressed L on my keyboard and I've jumped to all the tests beginning with L. So this can be a great way of quickly jumping across. You can see my horizontal scroll bar has jumped halfway across. So a little tip there, press the first letter of the test that you're looking for, just to make it a bit easier. And then we can maybe use the arrow key to move across a column at a time. Once you have found the test that you're looking for, double click to move it over to the selected tests. Moving over to groups, it can be quite beneficial to create your own groups of tests. Let's have a look at how we can create a group before adding a group to our selected tests. So what I'm going to do is do a right click here and you see the group maintenance option appears. And I now have the ability to potentially edit an existing group or even create a new group. Apologies, I probably am not adding tests that relate to each other, but just demonstrating for training purposes. Let's have a look at my lunch and learn group. So there you can see my lunch and learn. I'm going to double click and let's have a look and let's notice what happens under selected tests. You can see all my tests have come in there nice and quickly. So groups, again, can be a great way to just save on a little bit of time. With your groups, they are available to all the doctors at the clinic. It's not just your own user, so just be mindful of that. When creating groups, you may want to have your other doctors in mind and potentially benefit them as well. My last step to actually confirm my pathology test here is to click on the Order Test button. When I click on the Order Test button, I'm just going to say fasting there. When I click on the Order Test button, you'll notice that a few things have happened. First of all, it's added it down the bottom here in the Today's Referrals window. This is basically a print queue. It's parked it in a queue in the event that we want to order maybe a radiology test as well, or write a referral. Rather than clicking on the print button several times, it allows us to do it at the end. So what we'll actually do is we'll add in a X-ray as well. You can see this too defaults to favorites, just like our pathology. Any radiology labs that have been linked with the system will appear here as well. I've got my copy to doctor, which I'm going to remove in this case. And one of my favorites, I'm going to order a chest X-ray there. Just like pathology, any notes that you want to appear or any text that you want to appear on the test, you can enter that here. And your final step is order test. As you can see, it's added it to my queue. And I forgot to mention with when we ordered our pathology test, the second thing that's happened is it's also added what we're doing, our referrals. It's adding it to the progress notes for us as well. It will appear in blue, so it kind of stands out in the history view. And lastly, our referral letters. You can choose a different document for your referral letter if potentially the doctors have their own specific referral letters. You can choose that. Where this is coming from is the global setting in clinical that it's been set as the standard referral letter to appear every time. Just to quickly show you, it brings up the template library. And if your doctors do have specific referral letters, you can pick them out here. The letter subject, You can put in a unique name. It will create a letter subject for us, and I'll show you that in a moment in some reviews. Let's have a look at our referral letter. I'm going to click on Write Letter. And here's my standard referral letter. Great. Just be mindful also, right up the top far corner, right corner of the screen, you can see the X button that we're all familiar with. I've got a bit of feedback that some of the doctors are a bit nervous about using that X button because they haven't actually saved it, and they may have had bad experiences in the past with losing their documents. Let me assure you, this is a close and save button, and we'll see that now. I'm going to click on that little X. It's going to ask me, do you want to save this? Indeed, I do. Click on yes, and you can see it's added it to our print queue there. Normally at this point, what we'd do is click on the print referrals and close. What it will do is prompt me at each step, because obviously we're using different paper types with our referrals here. So it'll prompt me first in the order that it appears in the queue here. So it'll prompt me first for the pathology, enter the pathology paper and ask you to click OK, and it'll start printing. Once it's printed the pathology test, it'll then prompt you with, please enter in the radiology paper and click OK. It will print out the radiology test. And then finally, because your referral letter prints on standard blank paper, which is already preloaded into your printer, that would just output that through the printer without any prompts on screen. Great, so that's referrals. Looking at immunizations. Clicking on the add button will allow us to choose the specifics of our immunization. If it's not the doctor administering it, we can change who it is. Maybe it's the nurse, or it's not given here. Clicking the down arrow in our brand vaccine menu will expand out all our options available. We could click on manual and free text in a brand or vaccine there. All that's left to do would be to fill out these details as required. And if we're uploading to AIR, we will need a dose entered in here as just a whole number. It won't accept 1.2 mils, for example. The closest round off would be 1 mil. So what we would enter in there would be 1, for example. Just to demonstrate what the childhood schedule looks like, Zedmed will know, it will look at the patient's age, and depending on the age, will reflect what we see here. So you can see with changing the age, we now see the childhood immunization schedule appear. And what I can do, it's picked up the age that they're 4 years old. I can double click on this heading here, and it's going to take me through basically what's listed underneath there. So that's what the childhood schedule looks like. Allergies. This is where we can enter in our allergies. You will need to record some allergy information in order for the drugs module to work. So we won't be able to prescribe any medication unless there's allergy information recorded. If there are no known allergies recorded, or they're not, simply the patient doesn't know, we do have the no known allergies button down the bottom here. As you can see, there is a filter here, and you can filter your search results. The common mistake here is, as an example, I'm going to type out peanut, I'm going to click find, and it hasn't found anything. Now, we all know that peanut's definitely an allergy, but common mistake is doctors tend to overlook this little section here. So choose the appropriate option up the top. For example, non-medicinal, click find, and here's all my peanut allergies that are appearing there. Again, like our immunization module there, you would fill out these details as required. What I will mention is the trigger script warning option. Depending on the particular allergy that you're recording, you may or may not want to trigger that script warning every time you're prescribing medication. Excellent. So that's the allergies module. Looking at diagrams, we do have the ability to kind of put our artistic hats on and get a little bit creative. Some people will either love this or they'll either hate it. I'll do a quick demonstration. This is very similar to an old version of Microsoft Paint. It's quite a simple little module here. And I'm going to demonstrate, for example, if my patient has just had potentially had surgery on their finger and we want to record that in the system, and they've come back and they've still got their stitches from a surgery a week ago, for example. I can kind of draw here using the tools that are available up here. And how do we know what's going to perform what for me? If I just point at it, it's kind of going to give me a hint as to what it's going to perform. If I want to be really thorough, I can point at it. Maybe I can annotate it with a label. And there we go. Change my text to black. No, there we go. So a very quick demonstration of the diagrams module there. Be aware that there are different views. Well, I'm just going to save that one. Yes. So we've got the muscular view there. We've got organs, skeletal, all different kinds. That's the diagrams module. Any diagrams that you create, you'll be able to find in the images under summary views. There it is there. I can right click and say view image. Oops, looks like I saved the wrong image there. Alrighty. Moving on to templates. So there are some pre-built templates available for use. These can be customized. You can create your own templates there. These have just been preloaded into your system. If we just have a look at what they look like, you can see it's a nice, easy form to click yes, no, and answer the questions there that it's presenting. What this will do is convert it into plain text into the progress notes, saving you to free text or manually enter that data in. There you go. The chronic disease management module. You can see here are all the different care plans that we have available. Depending on what you select here will generate the associated template automatically. And you can view the template by clicking on the Run button. Be mindful that with the care plans, it will link in with your billing wizard as well, in case that we forget to add that specific item in the billing at the end of the encounter. Lastly, there are some calculators available to you in the system. Let's have a look at the depression, anxiety, stress scale. As you can see, It is a form that we can fill out if it's appropriate with our patient then and there. You do also have access to print this out as well to hand to your patient to fill out later on. So that's our patient encounter and looking at some of the different encounter modules that we have available. Before we look at My Health Record, I just wanted to touch on the RFE field here. Now, the RFE field is what it stands for is reason for encounter, or what symptoms your patients are presenting with. The RFE field can be quite beneficial if we're using coded RFEs. Coded RFEs are basically a specific list that's been set up at the clinic for the doctors to use. So what it's trying to do is create consistency with the RFE, with the RFEs that are entered into the system. What I wanted to demonstrate with coded RFEs is there's a few benefits to using coded RFEs. One of them I've just mentioned. The other one is using coded RFEs will also allow you to pre-populate some text into progress notes. Now, this can be as short or as long as you see fit. This could be one line, as I've just created here. And apologies for my RFE code there. I haven't been to medical school, so that's the best I could come up with. But just to demonstrate the use is, just want to demonstrate that again for us. Just going to clear out what I've entered there. On the keyboard, I've pressed the letter T. Up comes the code that I'm looking for. Double click, and it populates my text there. So a great way to kind of perform functions automatically to save time. Maybe you've got an examination template of your own, for example, and you could put in the RFE code and have the form pre-entered into the progress notes there. So quite a handy function. To set up the RFE codes, will be in the Tools menu, Clinical Setup, RFE codes. Something else that's quite similar in terms of, if I can call it auto text, where text automatically populates in the progress notes. We also have something similar to text macros. And again, that's under your Tools menu, Clinical WP Setup, Auto Text. Now, auto text is another good one where we can create a shorthand code and it can populate with a whole series of text. And that can be as short or as long as you like, as I've mentioned. Now, a common one, IMM. Oh, I forgot to click on Add New. Let's do that first. Great. IMM. My longhand will be the word immunization, and I'm happy for all users to have access to that one. Let's have a look at that in action. Find a spot in my progress notes, IMM on the keyboard, hit enter, and there's my longhand, if I can call it that. So auto text is a good one. It is a good time saver, and if you have your own templates, if you will, auto text can be a great way of entering those in the system and can be a great time saver when you're in your patient encounters. Excellent. Now, I just want to conclude our session with the My Health Record, just a quick overview. So I've got a screenshot here of My Health Record that's actually linked in with the Zedmed system. What I want to point out here is the green My Health Record or eHealth folder. It also appears here. It's quite small, just under our patient details. And what this is saying with the green folder, that the patient, well, first of all, the patient has opted in. Secondly, Zedmed has been set up. And with the green folder that the patient has given the doctor ability to either add a shared health summary or add or upload an event summary. What's the difference? A shared health summary is a general summary of the patients and does not include encounter-specific information. An event summary, however, is encounter-based. It's used to capture specific information about a significant event relating to the patient's health. So like a cardiac event, for example, we might want an event summary so we get the specifics of the encounter. Other colors that we may see with our folder, we may see an orange folder. An orange folder is indicating that the patient has allowed for restricted access. And I believe from memory, the orange folder also has somewhat of a strike through to it, saying that it is restricted access. And in that event, the patient will be able to provide you with a code to then have access to their record. Just to show you, as I was mentioning, the shared health summary or the event summary, you would do that from the quick documents menu down to my health record summaries and choose the appropriate option there. Now, in order to upload, there's a lot of specific settings that need to be entered into the system. So the first step, if I just go back to clinical, it is in the clinical side under global options. Under communications, you'll see here the SMD and My Health Record tab there. So this would be the starting point to link in your certificates. It will prompt you for your passwords, so you will need that. Going into Office to link in, again, to link your system in with My Health Record. Looks like the doctor hasn't got sufficient privileges. Let me log in as an admin. In practice setup, you will need to enter your HPIO number here. Choose your organization type and the organization service. You'll also then need to add your doctor's HPII number, which is just entered in here. With regards to nurses, that will be under the Utilities tab in the Security module. Pick out your nurse, into Edit, and here's our HPII field again. With regards to our patients, on the left-hand side in the sidebar, we have the eHealth. And once the Zedmed system is linked with My Health Record, these buttons will become active. So you can even perform a search of the HI service if the patient isn't quite sure what their IHI number is. And you can even register your patient through the Register for My Health Record option there. Thank you, everyone. That's all the content that I had for today. Just a couple of items to wrap up our session. You will need to, just a friendly reminder, you will need to register for all the future Lunch and Learn webinars through our website. Again, if you've missed any of today's webinar, they will be recorded and uploaded to our website. Also, please feel free to send through any feedback with our Lunch and Learn webinars. We value your feedback quite deeply, and it allows us to get better and make our training sessions and training content specific and more tailored to meet your needs. So we'd love to hear some feedback. Some learning resources and support resources for you. We do have the client login section of the Zedmed website, a really great resource for how-to guides, clinicians manuals, reception manuals, things like that. We have this support help desk with our friendly, lovely team that are available Monday to Thursday, 8 a.m. to 5:30 and Friday, 8 a.m. to 5 p.m. We do also have after-hour support for those emergencies and urgent inquiries. You can see the timeframes there from 5:30 to 8 generally. Thank you so much, everyone, for taking the time out of your day to sit in on today's Lunch and Learn on going further with clinical. Have a great day, and we'll see you next time.